Hi, everybody. It's Bonnie Watson Coleman, and I am the congressional representative from the 12th Congressional District, and I am here with a special guest.
Hi, I'm the CEO of the Community Food Bank of New Jersey. My name is Elizabeth McCarthy.
And so we're here today because we want to talk about the wonderful work that you all do. I just didn't understand that this was such a massive undertaking here and that you supply food to so many different counties. But we're in the middle of this shutdown. I don't know what kind of impact that's having or will have on you. So I just wanted to kind of have that conversation with you. Have you felt anything yet? Have you felt?
Yeah, I mean, even prior to the shutdown, we've sort of felt some of the implications of changes in federal policy. So we distribute over 100 million pounds of food a year. I mean, as you said, it is a massive operation. But we've had about a 35% cut in the food that we get from the USDA, from the federal government. So we've had to make that up through food donations from grocery stores and lots of retailers that we work with, and then private donations as well.
So why was there a 35% reduction from the USDA, if I might ask? Over what period of time, too?
Yeah, from January. So it's often unpredictable what we do get from the USDA. It certainly has fluctuated a bit over the years. It's odd, it's strange, it's not usual to have that big a drop at one time. But at the same time, need is going up. So we were not in a position where we wanted to cut back what we're providing to our 800 partners. So we have had to make up the difference.
So USDA is your primary source of food, right?
Our food, some comes from USDA, some comes from donations. That's a huge amount from, Wakefern, ShopRite, Amazon Fresh, places like that. And then the rest we purchase through funding through the state of New Jersey, but also through private donations.
So is the funding coming from the federal government to the state government? Or is it just
some
all
of
state?
It's mostly state, because some states don't get the kind of support that we're very lucky in New Jersey that our elected officials have made food insecurity such a high priority. And so we do get funding from the state. The federal funding that we got, a lot of it was cut because it was the produce, the program, LFPA, that was to buy local produce, that was cut. And then our nutrition ed program was also cut.
I want to ask you two questions. Number one is, have you noticed anything different from the local partners you have, the supermarkets, in what they've been able to voluntarily share with you? Has there been a decrease in any way, shape, or form?
There has not. We have really incredible partners, and they really work with us, and even to the point of, we've really been trying to get more fresh food out to people, so produce and frozen proteins, and they've been great about responding to that. Produce, obviously, you have to turn it around really quickly, but they have been amazing, so we're very lucky.
From your vantage point right here in this huge complex, you don't necessarily deal with individuals, or do you? Can individuals come here?
We do not have a pantry here in Hillside, but we run several pantries. So we run one in Bergen County in Garfield. And then we have another warehouse down in Egg Harbor Township. And there we have a direct services pantry, as well as a mobile pantry that goes around South Jersey because, it's much more rural there. People have to travel much further. So we have a mobile pantry that actually goes to them. So we have the 3 pantries that we run ourselves.
Have you been getting any reports on the impact of the government shutdown?
Yes. So a lot of federal workers missed their first paycheck or half a paycheck last week. And we've already been in touch with the TSA about doing a distribution for workers from Newark Airport. We've also reached out to the FAA office down in Atlantic City and the Arsenal out in Picatinny to make sure that if the pantries around there need some reinforcement or need some help, that we can respond.
So when I came into the complex, I see these massive trucks that are probably involved. Do you see the prospects of a diminution of food that you're going to be able to distribute at a time where we may have an escalated need?
Yeah, we've committed to our partners that for our fiscal year is July to June, that we would keep our distribution the same as last year. Unfortunately, with the shutdown, I don't think that's going to be enough. So we are going to rely on donors to help us be able to make up the difference. Because, as we found out last week, there's a good chance that there won't be any SNAP benefits in November. There are 850,000 people in New Jersey who are on SNAP. So even if, a quarter of those people have to turn to pantries, we're going to see the demand go up dramatically in November, a time where, Thanksgiving, everything else.
All the holidays,
yeah.
yeah. And the wintertime where people are eating heavier and
Yeah.
What is it that anybody who's checking us out on live stream right now could do or should do to be helpful in this space at this time?
Yeah, I mean, the nice thing is that people ask us that all the time. I think when people hear about this, it is always, what can I do? There's many ways to get involved. So on our website, you can see ways to volunteer. We have about 90,000 volunteer hours a year here. So that's like 40-something people that I'd have to hire for that if I didn't have the volunteers. Instead, we can use that funding for food. So volunteering is huge. Here at one of our pantries, there's many ways to get involved. And then people do food drives or diaper drives or period product drives, because those are things also that keep people from being able to go to work, being able to go to school. So those are big. And then honestly, we have such purchasing power that really donating cash is probably one of the best ways, just because we can buy much more than you could probably buy if you went to the grocery store and then donated that food.
One of your very knowledgeable staff members kind of brought us up here on the elevator, and I peppered her with questions before coming in here. I asked her how many people were employed at this bank, and she said somewhere around 200.
We have 300 employees altogether, probably, but some are down in Egg Harbor Township, so that's probably very accurate.
And so how do you pay them? With what is the source of money?
So we get funding from New Jersey. I'm from the state of New Jersey for part of our funding. And then we have to raise a lot of private money every year. So we do that, through some events, but through direct mail. And our donors, it's really amazing, because they really range from like very, very wealthy people who give large donations, which is wonderful. But we also get, the person who gives $5 a month because that's what they can afford, but they really want to help their neighbors. And they just think it's just not right for people to be hungry. So it's really a wide range of fundraising.
Considering that New Jersey is a source of your ability to pay your employees, and I would suspect that some of that money comes from the federal government, have you any idea if and when that could impact the number of employees that you'd be able to support in this effort, which is life and death in some cases?
Yeah, I mean, the cuts from the federal government, we just laid off about 28 people because and it was a program, it's called nutrition education, which I think people think, oh, isn't that nice? You're educating people on nutrition, but it's life-saving and money-saving in the long run because of the healthcare costs. So it was really focused on people who are in communities that we know are more likely to have diabetes, have high blood pressure, all of those things, and teach them how to really use food as medicine. So that was a real hit for us to have those 28 employees. But the others, so far our funding's been pretty stable. We're just trying to sort of make sure that we can keep putting out as much food as possible.
Since we're on live stream and we're sharing this time together, and I'm so grateful for your time.
I'm grateful for you for visiting us.
Thank you. Is there anything else that you would like to share or ask me, or just, notify people who are listening?
I do have a question for you, but first, I think the one thing I always like to make sure people understand is just what hunger looks like, because it doesn't look how people think it looks sometimes. I mean, there's over 1 million people in New Jersey who are food insecure, and I think people have in their minds visions of, people who are homeless or drug addicted, and certainly we serve anyone, so we serve those people, but most of our pantries you would go to and find people who are working, who are, sometimes working more than one job, or who are caring for their children. And it's not people who are trying to in any way take advantage of a system. It's people who just can't make it to the next paycheck. Their wages have stayed stagnant while costs have gone up. And I think really it's eye-opening for people. We often have people come and say, I never thought that I would be here at this pantry. And I think it's important that people recognize that it could be their neighbor, that it could be, the parents of the kid on your child's soccer team or whomever, and you just don't know what could happen in life.
The last time I saw that was during the pandemic, during the COVID pandemic.
Yes.
And we saw just cars lined up. And I mean cars, SUVs that middle-class working families have. And it did give us another insight into just how vulnerable people are if their source of income is cut off.
Right. Well, they say 37% of
right.
people can't withstand a $400 emergency.
Exactly.
And that just tells you.
But
Yeah.
that was created because of a pandemic and
Right.
COVID that we had to muscle up and get ready for. This is a man-made problem that we don't have to deal with and shouldn't have to deal with. And so I worry that at a time when our need may escalate if we don't get government open as it should be so that we can work for people and people can get paid, and that people who do God's work like you are going to see a big boom in how many people are going to need.
Yeah.
At the same time, a sort of a stabilizing of what's going to be available to you. And that's sad to think about.
It is. So my question for you is, when people do ask us, like, how else can I help? How can I advocate? How do I get my voice heard? Like, first of all, do you think there's any chance at some point down the road that we'll be able to reverse some of the changes made in HR 1? Is one question. And how does an average citizen, if they want their voice to be heard, like, what are the most effective ways for people to get out there?
Thank you for asking that question. I tell them, you call people who are elected at all levels that have a responsibility in this space, and you let them know what their need is, and you let them know what you expect of them as elected officials. And then I ask people who live in New Jersey and have a government that's willing to share its resources, that I know you got family that live in other states where people are suffering, if not as much, even more, where their legislators aren't moving into the space that they need to move into to ensure that government is operating and food is being distributed and people are being resourced as appropriately as necessary. To have your family members and your friends in those states call those legislators, because like you said, hunger is not what you think it is. It is not poor, homeless, and down and out people. It's everyday working people. It's people who never ever, as you said, thought they'd ever be in this position again, and they live all over this country. And so having your elected officials on every level, in either party or no party, to understand what you expect of them, that they need to do their job, and to have them tell all those federal legislators, get the heck back into Congress and pass the laws that you need to pass, and to preserve the health care, preserve USAID, preserve USDA, protect our farmers who deliver to you, who are able to then give to families. That we're all in this together. One way, shape, or form, we are being touched, and we need government to get back together again, and we're willing to do it. Let's just make sure we're preserving and protecting the rights and the expectations of people, their health care as well as their food, because as you said, food is a good medicine. It is an alternative to being ill. And so I thank you for doing God's work.
Thank you. What keeps you so optimistic? You seem to have
I am an
hope.
optimistic person.
Yeah.
I have a strong faith, component in my life. I believe that the God is always there on the throne, and at the end of the day,
infectious. Thank you.
Yes, thank you. I appreciate the time.
Thank you. You too.
So now you've heard from this wonderful CEO. Please reach out, be helpful, be willing to volunteer and support here, but also make sure that you're calling your legislators wherever they may be.